This is the second video in a series of 3 this morning on hypertension. This is pregnancy hypertension or preeclampsia. What I'm going to do in this one is to combine some historical observations with some new observations to come up with a better explanation of preeclampsia, which is open to testing. So this work's been done in Shanghai, in the Department of Pathology over here, in the hospital of Professor Huang He-Fong, FRCOG. Professor Huang runs this. This is her unit, 16 floors of wards here, an outpatient block, and the service delivery unit here just for obstetrics and gynecology. 16,000 deliveries. I don't know how many operations, but they're all very nicely done using minimal access techniques. The man that we're going to concentrate on is Otto Speigelburg, this man who was a professor in Breslau for a significant part of his career and is well known in German obstetrics and gynecology for developing the criteria for ovarian ectopic pregnancy. But he wrote something significant in the second edition of his textbook of midwifery, and it was this about preeclampsia. And what he pointed out was two important factors. One, that there was an irritation of the sensory nerves within the uterus, and that proceeded in a reflex manner to the kidneys. Two important observations, which we're going to spend a little more time dealing with. This, remember, was taking place before there was any sphygmomanometry of any kind. This was purely on his clinical observations. So we think a very important observation and recording of that observation by Spiegelberg. Now, this idea of uterine stretch is next taken up in the laboratory of Kenneth Franklin in Oxford in 1945 to 1948. He was working with Joseph Trueta, who became the professor of orthopedic surgery in Oxford for many years. He developed the Nuffield Orthopedic Centre, among other things. And then there's a third man who we don't have a photograph of. He's an obstetrician called George John Sophianopoulos, abbreviated to Sophian, who became a consultant in Plasto in East London in the second part of his career. And what they did was they found this in exteriorized rabbit kidney. And they're doing an arteriogram here of the normal kidney, showing the normal blood supply of the renal cortex. But when the rabbit suffered a major limb injury, then you see this vasoconstriction of the cortical blood supply and the redistribution of the blood flow to the renal medulla. It's called the Oxford shunt. And what Sophian did was he reproduced these observations in the rabbit by blowing balloons up in the uterus. So what he did was he put a window in the side of the rabbit's abdomen to look at the kidneys, put some balloons in the uterus, and as he blew the balloons up, the surface of the kidney went pale. If he divided the nerves between the uterus and the kidneys, then that reflex did not apply. At the same time as all this was going on, Arthur Hartig in Harvard in the USA had found these narrowed arteriolar walls in the placental bed in preeclampsia. And all subsequent co-workers of, this one was Zeke and Asali, this one was Dixon and Robertson, this one was Pienenburg and Brosens, all found this thickening of the arteriolar wall in the placental bed in preeclampsia. What they didn't discuss was this halo around the thickened arteriole here, 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 and here of hyalinized cells, which I'm going to show you in this form. This is a pregnant placental bed, and this is a narrowed arteriole with this halo of hyalinized cells in it. And that, we think that reflects, we haven't proven it, but we think that reflects this halo of injured nerves around the thickened arteriole And these nerves do not extend from the uterus during pregnancy. They stay in the lower part of the uterus. They don't extend to the placental bed. All you see in the placental bed is the thickened arteriole with the halo of hyalinized cells. So this shows it in a different form. We think that the nerves stay here, and as the uterus increases in size, you only see the elongating arteriole together with the halo of nerve sheaths around it. We think this is the mechanism of injury. Here's a normal on the left, normal arteriole on the left with its nerve. If you injure this, you release a soup, shower, or storm of cytokines, which leads to regeneration of injured nerves from a proximal stump and thickening of the denervated arteriole. So there are two effects from the single injury. And of course, this can take place before pregnancy or during pregnancy, but we think that these injuries largely establish before pregnancy and contribute to the problems during the pregnancy. The second key observation is we found, again, in narrowed arterioles, but also in myometrium, we find expression of this purinergic stretch receptor, P2X3, which we think is extremely important in terms of uterine pathophysiology, both in terms of obstetrics and gynecology. And we think that this is important in the initiation of the uterorenal reflex from the uterus, which causes the redistribution of blood flow in the kidney and the symptoms and signs of preeclampsia. We think this is approachable in experimental terms, and we may be able to demonstrate changes in maternal renal artery waveform during pregnancy and at the time of delivery, which would be critical in this context. So we think two historical and two new observations may shed a little bit of light in terms of the etiology of preeclampsia. We think it's better viewed as a disorder of uterine stretch rather than as a disorder of placentation. The emphasis has been on the histological terms, histological descriptions of the placental bed since Hartig's observations in 1945. We think simply the uterine stretch is a better model, a better way of looking at preeclampsia in these terms. So thank you very much for listening. I hope that's something new, a little novel, a little new, and we're going to discuss it further in the next video, which will be about adult hypertension. Thank you very much for listening.